Hi, my name is Kim Evans, and I'm the CEO of Affect Hope. Like many of you, I have overdosed on COVID-19 news over the past few weeks as I've sought to understand the implications of the pandemic for myself, for the team I lead at Affect Hope, for Canada, and indeed for the world. And I'm beginning to wonder whether the North American media is losing sight of what might be the bigger story, the impact of the pandemic on the developing world. I've caught glimpses of near riots to get food in places like India and Kenya, but I'm convinced that these are only glimpses of what is likely to soon be upon us. Just last week, Oxfam predicted that the pandemic is likely to push 500 million people into poverty, unless there are some big interventions. The pandemic is already setting up to seriously widen the social and economic gaps that already exist in this world. Early evidence suggests that those in lower economic brackets are more likely to get the virus. And even if they don't get the virus, they are more likely to suffer a greater loss of income and even face starvation in some places due to lockdowns, quarantines, physical distancing, and other measures. Many will never recover. It's even worse for the people we serve at Affect Hope who suffer with neglected tropical diseases. At the best of times, these folks have serious difficulty accessing appropriate health care. Many of them live with underlying medical conditions and compromised immune systems. The pandemic will make it more difficult for them to access health care. And if they catch the virus, they are far more likely to die. As a Christian international development organization working in public health in developing countries, we can't simply stand by and let this happen. I personally believe that to whom much is given, much is required. And that's why Affect Hope wants to be there for our partners in developing countries, just like we did in the Ebola crisis a few years back. We want to help them in their battle against COVID-19 because we know that their health and safety affects our health and safety. And moreover, because it's the right thing to do. We have an opportunity to respond. And that's why at Affect Hope we're putting our past experience in handling pandemics and our expertise in strengthening public health systems to use in a new partnership with Lepra UK and the Government of India. Together, we will repurpose the lab at the Blue Peter Health and Research Center in Hyderabad, India, to start COVID-19 testing. We are raising funds to purchase 2 new PCR machines to conduct the tests. The machines cost about $60,000 Canadian, and there will be ongoing costs for the conducting of the tests. One machine will be used in the lab to process tests at a high speed, and the other will be used for mobile testing, which is vital for our work in rural India. But I need your help. I need you to join me and help save vulnerable lives in India. These people are counting on us to deliver them from this pandemic. So please visit us at affecthope.org/COVID-19 to learn more or to make a gift. And please, stay safe, keep the social distance, and wash your hands a lot.